biologicals change the way of seeing and treating allergic disease. We are entering now in a era in which each severe patient can find really probably a treatment. Until a few years ago, the most severe patients didn't have the opportunity to improve their quality of life related to disease, while now biological agents give the opportunity to really reduce symptoms, reduce exacerbations, reduce the necessity to go to hospital, to emergency department, visit doctors and so on. And so in final, to really improve the quality of life of a great proportion of patients. There is a need of novel biomarkers because, as far as now, the few biomarkers used are interestingly related to the phenotypes, but not enough to really characterize the patients. So we need new molecules. I think that, for example, one molecule is DPP4, dipeptidase 4, which is a protein which seems to be more dependent on an IL-13 mechanism than an IL-5. And this is exactly what we need. We wanted to distinguish between two different mechanisms that are similarly involved, both involved in most of severe patients, but in some patients probably the IL-13 is much more important and the other one IL-5. So if we have the possibility to find a biomarker such as, for example, DPP4 that is more IL-13 dependent, we can distinguish patients in IL-13, IL-5, and maybe putting other biomarkers like this. We can even characterize better the patients. Another interesting biomarker is a biomarker related to airway remodeling, which is another important topic in asthma, in severe asthma in particular, and it is galectin-3, which seems to be really related to the predisposition of each patient to initiate and keep creating a remodeling of the airways.